Are you tired of pulling things back? Are your arms not quite long enough? Well, you might be experiencing presbyopia, which is the common phenomenon of the aging of the lens inside the eye, where we lose our ability to accommodate or zoom in and see up close. This happens to all of us. It's inevitable. It's due to natural changes within the proteins of the lens itself, as well as the muscular structure around the eye called the ciliary body. This happens around the age of 40 or 45 for most patients, and it's something that is certainly an inconvenience, but it is treatable. So what do most people do? Well, you get reading glasses. These can be purchased over the counter or online, and they come in different powers. The higher the number, +1, +150, +275, for example, means that you're getting more power, so helpful for patients on the older side, as well as for patients who need up-close vision, because the focal length of the higher numbers is closer. So you might need a higher number if you're reading something small up close to your face versus a computer screen a little bit farther away. If you wear glasses already as prescription for distance, then you might get a progressive or bifocal, and that can allow you to keep glasses on all the time without having to take them on and off, like with reading glasses. Or you could try contact lenses that have multifocal lenses that give distance and reading within the same eye, or monovision with one eye distance, one eye reading that can also be done with contacts or surgery like LASIK to allow you to have a more blended vision, but only seeing out of one eye at a time. So the brain has to adapt, and it's not tolerated by all patients. You might get some headaches or depth perception problems, so try this before you buy it. We can also do lens replacement surgery, where we take the natural lens out of the eye and replace it with a multifocal lens that gives distance and reading, or an extended depth of focus lens that gives distance and intermediate. These are great options. Or we can also do monovision with cataract surgery to blend distance and reading into separate eyes, so when both eyes are open, you see everything. But these all have some drawbacks, so make sure you talk with your doctor extensively about which option might be right for you. There are also medical options like Vuity, which are prescription eye drops that can be placed in each eye every day to give a little stimulation to the ciliary muscles to allow you to get that flexibility back, which does give a few hours, maybe 6 to 8 hours of some increased reading in some patients, but they can cause some headaches, so again, discuss this with your doctor. And lastly, there are some experimental treatments like Optic, which is a laser treatment of the cornea to increase spherical aberration. This is undergoing investigational trials as we speak, as well as other modalities like uncross-linking of the collagen around the ciliary body to increase flexibility as well. So there's a lot of really exciting developments within this field to address the universal problem of presbyopia. Now look, presbyopia is inevitable, but it is treatable. So talk to your doctor about which option might be right for you.